You've seen it scrolling through your feed, the absolutely flawless, glowing smile. It looks like a simple luxury purchase, right off the shelf. But the clinical reality of achieving that look is much more complicated. A smile makeover isn't actually a single medical procedure. It's a marketing term. In practice, it's a custom portfolio of different dental treatments, and the price tag can swing wildly, anywhere from $5,000 to over $30,000 here in Australia. This graphic shows factors involved in a makeover. On the left, aesthetic results. On the right, biological requirements and long-term costs. The price variance is tied to treatment intensity. As you move up the scale for complex issues, financial and biological requirements increase proportionally. To get absolute picture-perfect control over the shape and color of your teeth, a dentist almost always has to permanently grind away your healthy, natural tooth structure. Choosing a smile makeover starts a recurring cycle of clinical maintenance and financial reinvestment that lasts for the rest of your life. Before you even think about aesthetics, there is a hard medical prerequisite. No ethical dentist will start a cosmetic makeover without first treating any active oral disease. You also need to watch out for the title cosmetic dentist. In Australia, that is not an officially recognized medical specialty by the dental board. Both general dentists and recognized specialists, like prosthodontists, perform this kind of work. That places the burden entirely on you to vet their actual experience and credentials. If you try to apply expensive cosmetic materials over unhealthy gums or decaying tooth roots, the entire investment will eventually fail. Securing your biological health is the first step. If the underlying teeth and gums are unstable, any cosmetic work you pay for will fail as the body's natural support system breaks down. So, how do you decide what treatments make sense for you? Let's break it down into 3 tiers, starting with the lowest risk: surface adjustments. This includes chemical whitening and resin bonding. The biological input here is incredibly low. These procedures sit strictly on top of the tooth, preserving your natural enamel. The financial cost is relatively low, and you get an immediate aesthetic reward. You can repair minor chips or brighten your smile in a single clinical visit. But there is a major trade-off. The results are temporary and require strict behavioral constraints to maintain. For whitening to last, you have to actively limit foods and drinks with strong colors. That means cutting back heavily on your daily black coffee or red wine. And resin bonding has limited color matching capabilities and is physically fragile. It chips easily, which means you'll be making frequent trips back to the clinic for reapplication. Tier 1 gives you a budget-friendly, low-risk upgrade. It simply transfers the cost from upfront dollars into continuous, daily behavioral maintenance. Now we move to Tier 2, structural overhauls. This is where we find ceramic veneers and crowns. This diagram shows the extreme biological cost. The dentist physically drills away a thick layer of healthy enamel to make room for the ceramic shell. Look at the inner core pulsing red. Once cut, the tooth is permanently compromised. The financial input matches the biological severity. You are looking at costs upwards of $2,000 for every single tooth you alter. What drives people to pay this? The aesthetic reward. You get total, immediate control over the exact shape, size, and permanent color of your smile. But there is a hidden, long-term trap here. The ceramics themselves are not permanent. Veneers and crowns can break, chip, or fail at the gum margins. You will likely need to pay full price to replace them every 10 to 15 years. Tier 2 offers Hollywood perfection, but it locks you into an irreversible cycle of biological damage and repeating high-ticket expenses. That brings us to our final tier, foundational architecture. This covers orthodontic treatments like braces or clear aligners, and dental implants. The biological input for implants is highly invasive. It involves drilling titanium screws directly into your jawbone, waiting up to 6 months for fusion. Orthodontics, on the other hand, require applying sustained mechanical pressure over several months to physically force your natural teeth to move through the jaw. The outcomes here are highly functional. Implants replace missing teeth safely, while orthodontics permanently fix bite mechanics, making it much easier to keep your teeth clean for the rest of your life. There are unique systemic risks to consider. Implant bone fusion can fail, especially for smokers or diabetics. And with orthodontics, you will be required to wear retainers every night for the rest of your life to prevent your teeth from shifting back. Tier 3 provides the strongest long-term structural integrity, but it demands the highest investment of your time and the highest tolerance for systemic bodily risk. The ultimate rule of cosmetic dentistry is this: the best makeover achieves your visual goal while destroying the least amount of your natural tooth structure possible. This chart maps out exactly how to apply that rule. If you fit the profile of a budget-conscious corrector, your clearest path is sticking exclusively to Tier 1 treatments or clear aligners. Following this path prevents taking on debt and protects your enamel. But now, watch the chart expand for the functional repairer. If you have broken or missing teeth, your path points directly towards implants and crowns. Because this specific tier crosses over from elective cosmetic work into medically functional repair, it offers your only realistic chance for private health insurance rebates. Correctly identifying your starting profile prevents you from buying a highly invasive aesthetic solution when you only have a simple structural problem. Finally, we have the Aesthetic Optimizer. This is the profile determined to get that full mouth of flawless porcelain veneers. This graph highlights the financial reality check you must perform. An initial $30,000 investment at age 30 means recurring financial spikes at 45 and 60. You must ensure you can afford those replacements as the burden compounds. Cosmetic dentistry is an ongoing commitment to managing biological materials that require periodic maintenance and replacement. Your teeth are living organs, not accessories. Protecting their biological integrity is the only way to ensure a truly lasting return on your investment.